I'm Dr. Ng Chee Yung. I'm a general and colorectal surgeon practicing at Mount Elizabeth Novena Hospital in Singapore. I've been a doctor for 25 years. I first graduated. I've been a specialist surgeon for the last 15 years. Earlier on in my career, I worked in the public hospitals and was in the largest teaching hospital, Singapore General Hospital, and served there as senior consultant surgeon. And the last 7 years, I've been in private practice at Mount Elizabeth. Main expertise would be that of minimally invasive surgery for colorectal. And I practice a lot of laparoscopy as well as robotic surgery. And most of my work is in fact in this area. Now, I'd like to talk in terms of the treatment of what we're primarily concerned of. I treat a lot of colorectal cancer patients. And in terms of surgery for colorectal cancer, the last 10 to 15 years have shown dramatic improvements. And we talk about the improvements in our surgical techniques, we talk about improvements in the survivals of our patients, and we talk about the improvements of the patient's quality of life in how we can preserve the body's vital functions. So in terms of our surgical techniques, most of our surgeries now are being performed in a minimal invasive fashion without a need for any large incision where that inflicts a lot of suffering and a lot of long recovery times. Our latest Da Vinci robotic system has enabled us to do majority of our even very difficult operations through a minimal invasive approach, and that has improved the quality of our surgeries dramatically. The Da Vinci robot also helps us to able to preserve the good function of the natural anus and also preserve natural body functions governed by the pelvic nerves, which are your bladder and sexual functions. And the last 10-15 years have shown dramatic improvements in terms of the survival rates of our cancer patients, and this is no doubt due to better surgical techniques as well as improvements in chemotherapy and radiation therapy. In terms of the procedure itself, I think it differs very little. The intent of the procedure is exactly the same. We aim to remove exactly the same amount or the same areas of the affected part. So the only major difference is how we access to the organ. So in a traditional way, we would be doing what is called an open surgery, where usually we make a long cut in the belly, and that's how we can access the abdominal organs. But in minimal invasive surgeries, we only make very small incisions, and we put fine instruments in, as well as a camera, and we can do the same work through very small incisions. So that has advanced our practice in the last 10 to 20 years and improved patients' quality of life dramatically. In most cases, patients who have undergone minimal invasive surgeries actually have a very short hospital stay because they recover very quickly. Most of the time they may stay 3 or 4 days in the hospital, compared to in the past with open operations, they've usually had to stay 7 to 10 days. But it's not just the hospital stay that has made the difference. In fact, after discharge, within about a week or so, they feel very well and are able to participate in many normal activities. I would also add that in minimal invasive surgeries, usually the complication rates are even lower than in open surgeries in the past. The rates that we see of infections and also blood loss is actually lower in minimal invasive surgeries. That's why the patients do better. In any procedure where it is possible to do a full and complete operation through a minimal invasive approach, it will always be preferred compared to a conventional open surgery. Currently, in this day, we can probably perform at least 90 to 95% of all surgeries that we need to do in this manner. I guess as the technology improves, that figure will start to approach closer to 100%. So I guess there are still some patients where the procedure is of a complexity that is still not suitable for minimally invasive, but these are quite few now. Mount Elizabeth Hospital is actually extremely well equipped. We have got the latest 𝐷𝐴 Xi robot system, and this is the latest model that has been launched. And in this model, it has enabled many procedures that were previously not possibly done through a minimal invasive approach in the past. There are other specialized equipment that we can use. Also, we have a transanal endoscope, which is a set of equipment that allows us to operate through the anus and also remove tumors there, without needing any external cut. Last but not least, we also have the latest technology in terms of even the conventional keyhole or laparoscopic systems that have also given us great three-dimensional vision. Even in a conventional way of operating, it's a great advantage.